Thank you for joining us for this presentation on COVID-19. This training is intended to provide the staff teams of Liberty Post an overview of important information contained in the reopening plan for the 2020-2021 school year. This training will cover the following items from the reopening plan: how to spot COVID-19 and multi-system inflammatory syndrome, what to do if symptoms are spotted during the workday, the procedure for isolating and returning to work post-illness, and how to mitigate the risk of exposure. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Symptoms of COVID-19 include the following: multi-system inflammatory syndrome is a serious condition associated with COVID-19 in children and youth. Any child exhibiting any of the following symptoms will be immediately referred for follow-up to their healthcare provider. Symptoms of multi-system inflammatory syndrome include the following: any staff or child exhibiting any symptoms of illness will immediately be escorted to the isolation area. The COVID-19 system administrator will be alerted and work with other administrators to assist with next steps, including arranging for adequate supervision of the staff person or child, calling 911 immediately if emergency warning signs are present, contacting family members, parents, or guardians for immediate pickup and encouraging them to seek medical attention, closing off areas used by the sick individual and preventing use until cleaning and disinfection has occurred, opening outside doors and windows to increase air circulation in the infected area, ensuring responsible parties wait 24 hours to clean and disinfect all areas used by the individual suspected or confirmed to have COVID-19 or multi-system inflammatory syndrome, notifying the local public health agency, and completing an internal incident report. Liberty Post will follow CDC guidance for allowing a staff person or child to return to work or school after exhibiting symptoms of COVID-19 or multi-system inflammatory syndrome. If a healthcare provider determines that a staff person or child does not have COVID-19 or multi-system inflammatory syndrome, they can return to work or school once they are fever-free without the use of fever-reducing medicines and they have felt well for 24 hours, or they have been diagnosed with another condition and their healthcare provider provides a written note stating they are clear to return to work or school. If a staff person or child is diagnosed with COVID-19 or multi-system inflammatory syndrome by a healthcare provider based on a test or their symptoms, or does not get a COVID-19 test but has symptoms, they should not be at work or school and should stay at home until it has been 10 days since the individual first had symptoms, it has been 3 days since the individual has had a fever without using fever-reducing medicine, and it has been 3 days since the individual's symptoms improved, including coughing and shortness of breath. The best way to keep yourself, your coworkers, and your students safe is by mitigating the risk of exposure. This can be accomplished by conducting a self-assessment before heading to work, practicing regular and thorough hand washing, properly wearing and cleaning your face masks, and utilizing regular cleaning practices. Staff should complete a self-assessment by answering the following questions and attesting to them in the Dayforce application each day before coming to work. For more detailed information on how to access the assessment in Dayforce, please refer to your worksite reopening plan. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout the entire community, from your home and workplace to childcare facilities and hospitals. Follow these 5 steps every time. Number 1, wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Number 2, lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Number 3, scrub your hands for at least 20 seconds. Need a timer? Hum the Happy Birthday song from beginning to end twice. Number 4, rinse your hands well under clean running water. Number 5, dry your hands using a clean towel or air dry them. If possible, use a paper towel to turn off the faucet and exit the restroom. Though washing hands with soap and water is the best way to get rid of germs in most situations, if soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. Sanitizers can quickly reduce the number of germs on hands in many situations. However, sanitizers do not get rid of all types of germs. Hand sanitizers may not be as effective when hands are visibly dirty or greasy, and hand sanitizers might not remove harmful chemicals from hands like pesticides or heavy metals. To properly use hand sanitizer, apply the gel to the palm of one hand. Rub your hands together and rub the gel all over the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds. Cloth face coverings are an additional step to help slow the spread of COVID-19 when combined with everyday preventative actions and social distancing in public settings. To wear your mask properly, have the top of your mask close to the bridge of your nose and the bottom of your mask under your chin. A proper fitting mask should sit snugly on your face and be without gaps. Cloth face coverings should be washed after each use. They can be included as part of your regular laundry. Simply use regular laundry detergent and set the washer to the warmest appropriate temperature for the cloth used to make the face covering. Cloth face coverings can also be washed by hand. To do so, prepare a bleach solution using the formula below. Check the label to see if your bleach is intended for disinfection. Some products are not. Soak the face covering in the bleach solution for 5 minutes. Then rinse the face covering thoroughly with cool or room temperature water. To dry your mask, use the dryer on the highest possible heat setting and leave in until completely dry. Or air dry your mask by hanging or laying flat and if possible leaving it in direct sunlight. When cleaning workspaces and high-touch areas, such as door handles, tabletops, and light switches, utilize the following procedure. First, clean the designated areas with soap and water and dry them off thoroughly. After cleaning with soap and water, apply a disinfectant product, making sure to follow the directions on the label. Many disinfectants require you to leave them in place for a specific amount of time or allow them to air dry. Please refer to your work site's reopening plan for specific cleaning assignments and routines. If you have questions or require additional information, please contact your immediate supervisor and review the reopening plan for your work site. Thank you for the essential role you are playing in maintaining a safe work environment for us all.